It's time now for Ask the Surgeon, brought to you by Everett Bone and Joint. Everett Bone and Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
All right. Welcome back to Integrated Rehabilitation Group Health Matters. It's the Ask the Surgeon segment brought to you by Everett Bone and Joint. Joining us is orthopedic surgeon Dr. Ralph Haller. We're going to talk about shoulder joint replacement surgery. I didn't even know that they had the shoulder joint replacement surgery available.
Yeah,
I guess I didn't get the newsletter.
You didn't? You get the email?
No, I didn't.
So, Dr. Haller, how are you tonight?
I'm excellent. Thanks for inviting me, Maury and Shannon.
Yeah, thanks for coming down.
Coming.
So before we get into the joint replacement itself, let's talk about the shoulder joint and the mechanics of the shoulder joint. Then we can get into talk about what you're replacing.
Okay.
So the shoulder joint is a ball and socket, and describe it. It's got a big ball, small socket.
It has a... Just you took the words right out of my mouth,
Thank you,
Shannon.
yeah.
It's got a relatively small socket, and the reason it has that is so it can be very mobile. Like the hip joint is captured in this deep socket. It needs to be stable. The shoulder joint needs to be mobile. And it's dependent a lot on muscles for its stability rather than the bony anatomy.
So, the joint, being that it's a bony configuration, can actually develop arthritis in it. And so what are they doing now for arthritic shoulder joints?
It can develop arthritis. First of all, I should probably say that most shoulder pathology is not arthritis. It's rotator cuff, which is, again, a muscle problem since the muscles are so prominent in shoulder function. But like other joints that have cartilage, the shoulder can also develop arthritis. And the treatment for arthritis in the shoulder is similar to the treatment for arthritis in the knees and hips, which is more common. Anti-inflammatories, exercises, various injections, and arthroscopic surgery, and then joint replacement surgery.
Now, arthritis in the shoulder is caused by use, by genes, hereditary, that kind of stuff?
Probably both.
Okay.
There's people that dislocate their shoulders repeatedly starting at a young age. Those people have a higher chance of getting arthritis. And then there's people that get arthritis for no good reason, just like in hips and knees. It's probably genetic.
I see. And as far as the replacement goes, when is it the point? Because I dislocated my shoulder 1,000 times playing football in high school. I broke it a couple times. When does it get to the point where you have to replace it? When the pain is so bad, or
it's a last resort. You know, we like to try everything else first, and a lot of times you don't need the joint replaced. But if it's so bad that it hurts you all the time, you can't do things that you need to do, work or certain leisure activities that you like to do, and if the x-ray warrants it, like I said, a lot of it is rotator cuff disease. So first we have to make a diagnosis. Not every sore shoulder certainly needs a joint replacement.
So it's interesting that we've heard quite frequently about knee and hip replacements. Why have we not heard about shoulder joint replacements as much as the hip and knee?
I think they're not nearly as common. I think that hips and knees wear out because they're constantly used in a weight-bearing fashion, and a shoulder you just don't use it that much for weight-bearing. So unless you have abnormal motion in it, like someone whose shoulder is loose, it doesn't wear out that much.
And how long has this replacement been around?
The hips started in probably 69, 70, and then the knees came in the mid-70s, and the shoulder probably in the 80s. So it has been around for a while.
And so what is the operation? What is the operation entail on a total shoulder? Because I assume you're doing the total shoulders.
Yes. So it's just like the knees and hips where you're replacing both sides of the joint, and on one side you're putting plastic, which in the shoulder happens to be the socket, and you replace the ball with a metal ball that usually has a stem that goes down into the humeral shaft.
So it's just like you said, it's just like the hip. You're just replacing, again, the ball and socket.
You're basically resurfacing it. So you're keeping all the muscles, all the ligaments, everything else intact. You're just resurfacing. You're replacing the cartilage with metal and plastic.
We're talking to Dr. Ralph Haller, orthopedic surgeon from Everett Bone and Joint. This is the Ask the Surgeon segment. This might be a stupid question, but that's what I'm here for. I had the total knee done, and part of my recovery, the greatest thing was icing it, with the little cuff that I had on and stuff. How do you ice a shoulder comfortably? You know what I mean?
Yeah, it's a little harder.
Yep.
They make very expensive cryo cuffs that fit the shoulder.
They have one for the shoulder.
They have one for the shoulder.
Huh.
Or you can use a bag of peas. It's
very expensive bag of peas.
Very expensive bag of peas that tends to fall off, but
Okay,
it works.
so that's how that works. And as far as the surgery goes, is it the same recovery time as a knee, or is it longer? Or is it quicker? And the surgery itself, is it how long does that take normally?
The surgery is about an hour and a half to 2 hours.
Okay.
So it's in the same range as the hips and knees. The hip, I think, I've had a total hip myself, is probably the easiest to recover. The knee takes a bit of work because you have to work on the range of motion. It tends to get stiff. The shoulder tends to get the stiffest of all. The shoulders are a loose joint when they work really well, and when they go bad, they get really stiff.
Got it.
And when you do surgery on them, there's a lot of soft tissues that just turn into cement. And then we call on somebody like Shannon to help us out with that.
Now, how long are you
mobility?
How long are you in the hospital for?
Usually overnight or 2 days.
Oh, okay.
Yeah, so I mean, now you were talking about rotator cuff pathology. So if someone has a rotator cuff pathology, or the rotator cuff is just completely worn out and can't be repaired, but the joint's fine anatomically, what's the option for those folks?
That's kind of an unsolved problem. And you can do transfers of other muscles in for the rotator cuff, which usually don't work real well. The latest thing on the horizon is what's called a reverse total shoulder, which helps make up for the rotator cuff. And I don't know if you want to talk about that more.
Well, it's just kind of when you say reverse total shoulder, the type of total shoulder you're doing everything anatomically correct.
Correct.
And the reverse one is you're just flip-flopping the ball in the socket then.
That's right. And there was a French surgeon named Gramont who figured that out. He's a lot smarter than I am, and he figured out the physics of the shoulder. And when you don't have the rotator cuff, if you switch things around, you can get the deltoid, which is your big muscle on the top of the shoulder that's still working in rotator cuff disease. You can make that more efficient and have that do the job for you.
Okay, so
can I interrupt just as a layman over on this side of the glass?
Yes.
So you're taking your existing shoulder, taking it out, turning it around, and putting it back in. Is that what you're saying? No.
Go ahead, Ralph.
No. You're leaving the bones where they are, but instead of you have this shallow socket called the glenoid. Instead of leaving that as a dish, you put a metal ball on the glenoid, and then where you have the humeral head, you cut that off and you make a little dish there instead. And don't expect me to explain the physics of this because I don't understand it myself. It just works.
Well, what it does those procedures, you're not doing that procedure right now, are you?
I'm just starting to. It's come on in the last 5 years, and I just went to a course to learn how to do that.
Okay, so Tom?
No, that was my question.
Yeah.
I was kind of. I thought maybe we skipped ahead there, so I just wanted to make sure. So
right. So just for those folks listening out there, so the total joint that you're doing right now is mainly for arthritic shoulders and dysfunctional shoulders.
That's right.
You are learning and practicing developing a technique called the reverse for that worn-out rotator cuff.
That's right.
Okay. So going back just to the total shoulder patient, it comes down to quality of life then, whether or not to get that shoulder replaced.
Exactly. It's very similar decision-making to a total hip or a total knee.
How old are your patients you're seeing doing this too?
The shoulders tend to be a little older on average than the other joints. I've done them as young as 55, but the average is probably 70.
Wow.
What is the expectation following a total shoulder for functional activities, return to activity? What have you seen?
The main goal is pain relief, so they usually work very well for that. A lot of patients have this deep ache in their shoulder. They can't sleep. It's on their mind all the time. In terms of strength and range of motion, they usually get a little bit better, but they usually don't gain full motion after this procedure. They still are a little bit stiff, but they gain functional motion.
Could an overhead athlete, like a tennis player, someone who enjoys maybe not aggressive tennis, but just goofing around on the tennis court, return to that type of activity with a total shoulder?
You could probably do some volleying. Probably serve would be very difficult. You'd have to be have a top-notch, result to be able to serve tennis.
It's kind of like I'm guessing it's kind of like a total knee patient that the guy ran marathons. You probably don't want to run a marathon after you have a total knee, but you can jog around, right?
Right.
Yeah. Okay.
Interesting stuff.
Totally.
Yeah. So you just don't hear about it as much as you do again the knee and the hip. So it's out there and it's only getting better as time goes on.
Yes.
And so what is the total recovery time then? I mean, from the date of surgery, what is it, about 6 to 8 months or so?
Well, most people are pretty functional by 3 months, but full recovery 6 months, 9 months.
So, like, if you were like a carpenter or someone had really significant arthritis, needed to continue to work, and had that kind of work requirements, would they be a candidate for a total shoulder?
They could. I had a Boeing mechanic that went back and did that at about 3 months. He was a tough guy. Most people it would probably be more like 6, but it's possible to go back to that kind of work with a good result.
After surgery, are you in a sling or are you in some kind of brace for a certain amount of period of time?
You're in a sling for the better part of 6 weeks. There's a muscle that we have to cut in the front called the subscapularis. And you have to let that muscle heal before you move the shoulder in certain ways, or otherwise it could dislocate.
How long do these last?
It's about the same as for the other joints. Probably about 90% survival rate of the prosthesis at 10 years, and then they kind of tail off, and by 20 years, probably still half of them are working.
Yeah.
So again, just to review, kind of wrap it up here, for those patients that have significant arthritic changes in their shoulder joint, there is a technique that you're doing a total shoulder.
Correct.
And the candidate is this really comes down to quality of life and pain management.
Yes.
All right. So, and return to function is pretty good.
Pretty good, yeah.
Great.
Good stuff.
Yeah, absolutely.
Dr. Haller from Everett Bone and Joint, thanks a lot for being with us. If you're interested in having a shoulder replacement, go to everettboneandjoint.com.